Mahzebin. Today we will talk about the spinal cord. This is the viscera of the spinal cord with spinal meninges. The anteromedian fissure lies in the midline and the posteromedian sulcus lies posterior. Anteromedian fissure lies anteriorly and posteromedian sulcus lies posteriorly. And the conus medularis lies inferiorly and the spinal nerve lies lateral. So here we can see the portion. This is known as the spinal meninges. Basically it is the dura mater, and the arachnoid and pia mater will be attached with this spinal cord. And here we can see the H-shaped grey matter, and the other portion is white matter. And these are the nerve rootlets arising from the spinal cord. This rootlet will form ventral root and dorsal root. Dorsal root is marked by dorsal ganglion. We can see dorsal ganglion here. And the union of the ventral and dorsal root forms the spinal nerve. From spinal nerve, ventral ramus, dorsal ramus will arise. Then another more branches will arise from this ramus. And the ventral ramus, it forms plexuses. In case of neck, it will form cervical plexus. And in case of lower abdomen and lumbar region, it will form lumbosacral plexus. Basically, the spinal cord is 45 cm in length, and it arises from the upper border of the posterior arch of the atlas at the level of the foramen magnum to the lower border of the lumbar 1 and upper border of the lumbar 2 in case of adult. And in case of children, it ends at the upper border of the lumbar 3. And conus medularis lies at the terminal portion of the spinal cord, as it is the lower tapering end of the spinal cord. And from the conus medularis we can see a prolongation of the pia mater arises, which is known as Filum terminali. It extends from the conus medularis to the posterior surface of the first coccyx. And all these are Cauda equina. Cauda equina are the nerve rootlets formed by the lower 4 lumbar, 5 sacral and 1 coccygeal pair of the spinal nerve. And this all are the spinal nerves. This is all about the spinal.